Thank you. Thank you, Matt. You guys are doing some hard work, and we all appreciate it. Several questions, several issues, several concerns. We're in trouble. There were a lot of suggestions that fell on deaf ears that came from this Board of Commissioners. And there were some things that we did not do and decided not to do. And we're looking at spikes now that are unbelievable. First thing, preserving hospital capacity. Now I understand that's a top objective. And that's been a measure that we've been looking at in terms of putting together our numbers, putting together stats, putting together these great reports here. But, any set of numbers, any data set is very easy to manipulate into whatever you want it to say at the end of the day. Now, for the past 3 months, we've been talking up here, and we've been getting reports. For the past 2 months, there was a downward trend. There was a downward index. There was a downward inclination towards downward a slope of cases, whatever have you. I've heard it in all different forms. And every time that I've heard that, I've made it a point to mention up here that that was absolutely, positively not the case for 3 reasons. Number one, we meet here every 2 weeks. And every week we've met, I've mentioned when I've heard that we've had a downward slope, that's not true. The number one reason is the number of deaths that have increased week to week within those 2 weeks. I've mentioned that every meeting. The second reason is the number of hospitalizations that have increased every single 2 weeks from the last meeting we've had to the next meeting. The third reason was the ICU beds that have increased every 2 weeks from one meeting to the other. And I would pose the question every time up here, how on earth have we put together a downward trend in Fulton County when the Fulton County numbers every 2 weeks has gone up, higher, higher, and higher? Yet we're getting from folks, there's a downward trend going on. I did not think that was the case. It didn't make logical sense when the three main indicators were all going up every week for the past 2 months. About 5 months ago, I sent out many questions of serious concern about this coronavirus as we all watch this migrate from other countries into the United States. Those concerns are some things that we have addressed in one sense, but I don't think we've addressed them in a way that we could have fully addressed them. Additionally, over the last several meetings, I've asked several times for additional funding for PPE for the public. Yes, preserving hospital capacity is a good objective. But a better objective, I believe, lies in prevention. And I'm no hospital medical expert or doctor, but it doesn't take a slide rule to see if we were distributing those masks to the levels that we could have done with the type and size and scope of monies that we receive from the federal government through the CARES Act. I just don't see any reason why we shouldn't have done what I was recommending that we do and was what several of our commissioners were recommending that we do. Madam Clerk, if you could put back up slide 4. Doctors, CDC folks, epidemiologists, you name it, have said across the board that the most effective preventative measure against this are face masks and hand washing. That's been across the board as far as I've seen. These spikes, when I first asked for masks at the beginning of that piece there, 520, I was asking for reasons to prevent some of this stuff from happening. And we're talking about lives. I mean, that's not, that's not lost on anybody up here, I don't believe. But when you have $104 million, and if you ask for a small percentage of that to go towards face masks for the public. Again, our responsibility is to the public. And yes, that includes our employees. Yes, that includes our first responders. But everybody up here has a responsibility to protect the public. I asked in April about enacting countywide guidance to wear masks or face coverings. In April, our Public Board of Health Director said that, and it's right here in the minutes, that from what she's seen throughout the county, that we wouldn't need to even enact that guidance on wearing masks. That was in April. That chart starts in May. Folks, I understand we're doing what we can, but we got to think this thing through a little bit better, I think. And at the end of the day, again, I'm no expert, but my job is to serve and protect the public. Serve and protect the public. If face masks were the number one preventative measure, why were we voting down face masks 3 times? And we've earmarked a lot of this money. I think we need to look at it again. I think we need to consider broadening the scope of the decision-making process as well with some of these things. Now, I understand ultimately the decision is ours, but these numbers to me are absolutely unacceptable. I think we need to revisit and look at funding for our cities again. Commissioner Hausman brought up a piece to supply funding for our cities. I think that's something we need to seriously reconsider. Absolutely. Additional funding to our cities, because I believe that our local officials can give the most effective local response on a block-to-block basis. And that's where I think we are. And that's where I think the battlefields are going to be happening. And I think they can address that a lot better in their communities than we can if we provide funding directly to them. And we were one of the 5 entities in the state of Georgia that met the population requirements to get the type of funding we got. We were very fortunate to get that. I've seen DeKalb County giving a huge portion of their funding to their cities. That's smart. And I think it's something that we need to look at, and I think we need to reconsider. I think we need to reevaluate. The 3 times that I asked for masks for the public, it was voted down. I'm going to ask once again. And the reasons are obvious. I understand we put in $1.2 million for masks for the public. However, the allocation process in looking at that document, it wasn't quite as well thought out as I thought it maybe should have been. It provided masks for our school teachers, for instance, and things like that, which are needed. However, the school board is already providing that. So if we're going to do masks for the public, which we desperately need to do, I think we all need to make a decision on how that needs to go. Because at the end of the day, we are the people most closely connected to our public. We know what they need, we know where they need it, and we know what they expect from the government. So I want us to really look at some of this stuff for what it is here. There are people dying out here. This is a public safety, life safety issue. And anytime you got $104 million that someone's asking for 1% of that, 2% of that to go towards protecting the public, I only think it makes sense to go with what the commissioners are asking here. And I'm going to continue to ask. And I'm glad to see that we've got more money coming to the public. I wouldn't say it's just in the nick of time, though. Again, I've been asking for this for months. I have one other thing, commenting on Commissioner Morris's mention with the emergency doctors. I believe that obviously we're absolutely undercounting coronavirus deaths. I think we've got a lot of work to do, and I think we need to really start to think about what we're trying to do and what the actual ultimate goal is. But that money needs to be shared with our cities. I understand we've earmarked upwards of 80% of it or more. But we need to look at reconsidering allocating that money and look at some other options in terms of what we're doing here with the funding that we have to save lives. Again, this funding is to save lives. So I think we need to look at what we're doing and reconsider a lot of what we're doing and how we're doing it, because once someone is gone, they're not coming back. And they could very well be gone from a decision that we made up here that was the wrong decision. I couldn't get the mask I needed. I had to procure masks myself. My office personally has distributed over 22,000 masks in the last 6 weeks, personally from my office. But I could not get masks from this county to do that with. So I had to procure them myself. And I want to applaud my staff for getting out here in the trenches, in the battlefield, and making sure we got as many masks out to as many people as humanly possible. We're going to continue to do all that we can, just as long as I'm here. So I think we're doing okay. We're making progress, but we got to do a whole lot better. So that's all I got.
Thank you, Commissioner.